Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am the owner of Wells Legacy Health and Wellness, a full service family practice office in the city of Altamont Springs, Florida. I'm so grateful to be here with you all tonight to discuss a topic that impacts many of us. We all have men in our lives, whether they're our fathers, our grandfathers, brothers, uncles, cousins, colleagues, friends, neighbors, you name it. And so it was so funny. I got a message from a gentleman that I know, and he said, "Listen, I see you doing all this. Hey, sis, what about the guys?" And I said, everything that I do on Wednesdays, well, majority of the things that I do on Wednesdays are related to everybody, meaning it's not just for the ladies, it's for everyone, men, female, and the like. And so he was he was a little salty about my hey sis messages each and every day. But listen, I told him, listen, get comfortable because those are not going away. That is my passion to educate the women and to encourage women who are impacted by perimenopause and menopause, which is something that I'm dealing with myself. And what better way for me to have an outlet and to talk about and to research and share what I'm dealing with than to share it with women who I know in my community and abroad who are dealing with the same thing. I'm getting messages from women in Japan, women from all over the country and the nation thanking me for those videos and the encouragement. So I won't stop. They may look a little different, but I won't stop. But hey, friends will definitely be for the fellas. So hold on, gentlemen. Hold on, men. I got some stuff in the works for you all. And because of that, tonight what I want to do is focus on Movember. And in the month of Movember is where we discuss men's health. We encourage men's health. We talk about men. We talk to the men in our lives and those in our community about the importance of taking care of themselves. And so, fellas, go get your fellas, share this with your fellas, sit back, whatever y'all do when y'all chilling, right? Or if you're in the barbershop getting your hair cut, put this on live, put this live on speakerphone so that others can hear. And if you know one of your fellows may need this information, or ladies, share it with your significant other, share it with your cousins, your brothers, all of those people who can definitely benefit from this information tonight. So tonight we're going to be talking about Movember, and it's all about protecting our men from the inside out. From mustaches to mental health, we're going to talk about the numbers, the screening, and the small daily habits, small things, daily things that the men in our lives can do, and that men in our lives that we love can do to live longer. And there are some men who are very on top of their health care. They go and they get all of their screenings done. They do what they need to do. Sorry, y'all, my dogs are in the background. Do what they need to do, and they don't have to worry about someone poking and prodding them or pushing them and nagging them to go and get their screenings done. They are right on top of it, and I'm just grateful for that. November is Movember. It's a global movement using mustaches to spark conversation about men's health, prostate cancer, testicular cancer, and mental health. And so it's important that we focus on those things and that we talk about these things now, because we're at the end of the year almost. We're in November. We got a couple more weeks and then we'll be in 2026. And so for those men in our life who have not had their physical exams yet, you still have time. If you haven't gotten your prostate cancer checked yet, your colonoscopy checked yet, it's time. You still have time. If you haven't had your blood work done, you still have time. And some of the things I want to talk about, you guys know I love my statistics. And so some of the stats that I want to talk about when it relates to prostate cancer is 1 in 8 men will be diagnosed with prostate cancer in their lifetime. And in doing some research and just kind of listening and attending different conferences and things of that nature, being a family health practitioner, I tend to look for things that are going to give me all of the information that I need for my community of patients that I serve. And I serve babies to elderly, right? I serve a myriad of different patients from all walks of life. And I want to be sure that I'm staying in the know and up to date with the information, the statistics, the treatments, and things of that nature. And when it comes to testicular cancer, the most common cancer in younger men, typically between the ages of 20 and 44. And usually we don't think about cancers in that age group, but testicular cancer is the number one cancer in that age group. And so it's important that we educate all men, from the little boys in terms of brushing their teeth, hygiene, things of that nature, and continue that as they begin to grow and mature into teenagers and young adults and so forth. And so it doesn't stop. It starts early, but it continues. And then when it comes to mental health is something that I don't think is talked about enough amongst men. I'm grateful that we're seeing more men going and getting therapy, going to therapy, and there are more men that are open to receiving help, but we still have work to do. We still have work to do. And around the world, 4 out of 5 suicides are in men. And in the United States, men die by suicide 4 times the rate of women. And so we have to take the holistic approach, and we have to think about the whole person when we are talking about health. For those of you who are my patients or have come to see me, know that it's a whole session in there, right? Yes, you may be coming in talking to me about your blood pressure, but we're going to talk about stress as well. We're going to do a PHQ-9. I'm going to screen you for depression. We're going to talk about if you're dealing with anxiety and things like that. And so it's important that we understand the impact of stress on mental health with our men. And so men tend to carry their stress different ways. They deal with it different than females, right? Me, I'm gonna get frustrated. I may call my friend. I may, get my journal and begin to journal and let it out. I may go for a workout. There's things that I do to deal with stress, but many men don't feel that they have a safe space. And so at Wells Legacy Health and Wellness, we create that safe space for our patients to talk, to deal with, to work through, and to navigate all the things, right? And so over the next few minutes, or the next 30 minutes time that I'm going to be here with you, we're going to talk about men, the numbers that men need to know, right? And that we as women who love these men need to know. The screenings that could very well save their life. And then the mind-body habits that keep them here with us longer. And how we as women and family members can support, not nag our men, but help them into better health. And it's about making sure that they understand the importance of all the things. And so, as I mentioned, numbers to know, right? Prostate cancer, some of the things that I want you to know about prostate cancer. And if this is something that you've heard before, great, share it with someone else, right? If it's something new, tune in, because I'm going to give you some things that you can definitely take and put into practice, or have those conversations with your healthcare provider. So prostate cancer is the second most common cancer in the United States in men. Second most common cancer in the United States in men. And in 2022, there were about 255,000 new prostate cancers. That's tens of thousands of men who ended up dying from prostate cancer. Prostate cancer can be caught early if the screening is done in an appropriate time, if it's done ahead of time. And so we practice and I preach preventative health care. I practice and I preach prevention. And so whatever we can do to prevent it is going to be so helpful. Almost 3 million American men are living with prostate cancer at this moment. Black men are more than twice as likely to die from prostate cancer compared to white men. So what do we need to do about that? Get screened. And we're going to talk about the age at which these men need to be screened. And if there's a family history, what that looks like in terms of screening. We talked about testicular cancer. It's not an old man's cancer. However, it can happen in older men. However, it's most commonly seen, as I mentioned earlier, in those men who are between the ages of 20 and 44. About 9,700 new cases and around 600 deaths are expected this year in the United States from testicular cancer. A cancer that can be prevented, a cancer that if screened for and checked can be caught early enough and can potentially save someone's life. And the good news again, if caught early, it has a very high survival rate. And the key is caught early. It has to be screened for and caught early. A lot of times and I'm going to say we, because women as well find something abnormal with their bodies and don't say anything. They sit with it. And we need to talk about it instead of sitting with it. Ask questions, talk about it, let someone know. If you're not comfortable going to the doctor alone, or if you feel like you need someone to go with you, then do that. Take someone with you and get the help that you need ultimately. Mental health and suicide, we talked about this. In the United States, men make up nearly 80% of all suicides. The male suicide rate is about 4 times higher than that of females. And the key is getting help early. The key is having a safe space. The key is talking about it. The key is prevention. And how do we prevent those? As family members, what can we do? I have a question for you, those who are watching, who have men in their lives that they love. When was the last time the men in your life had a checkup? When was the last time you asked the man in your life, how are you really doing? Is there something that you need to talk about? What can I do to help relieve some of the stress or the load? Do you need to talk with somebody? Do you know that you have a safe space? All of those are important and they're all key when it comes to the mental health in the men in our lives. And so one of the 3 big checks that we need to make sure and ensure that our men are getting: 1, prostate cancer check, testicular, and metabolic. So prostate health. Prostate cancer, as we talked about, 1, it grows very slowly at the start, right? And this is why screening matters. It starts out very slow. And typically, the screenings happen or should be happening for men that are around the age of 50. However, depending on their family history or their ethnicity, we may start as early as 40. So if they're Black, or if they have a father, brother, or a son who's had prostate cancer, we're going to start those screenings a lot earlier than the age of 50. And then it's simple. The screening is just simple as getting a blood test done, a PSA. And some people have some information or there may be some controversy, shall I say, with the PSA. Certain activities can cause it to be falsely elevated, things of that nature. And so I say some screening is better than none. Prostate exam, depending on the guidelines and shared decision making. This is something that a lot of men are not comfortable with because it does require a digital rectal exam. And that may be uncomfortable or even an uncomfortable topic for some men to discuss. And so I want to talk about the symptoms and when to take them serious and not ignore these symptoms. If there's trouble starting or stopping urine, there's a weak urine stream, these men may notice blood in their urine, or if there's bone pain or weight loss. And typically these are signs that we see later in the stage of prostate cancer. And so if I could slide one question in about prostate health across the table to your man, what would it be? Drop it in the chat. If you could slide one question across the table to your man about prostate health, what would it be? Drop it in the chat. Put it in the chat, because I'm sure if there's a woman that's watching this that has a question, someone else has the same question. And maybe someone has the answer, or maybe we can provide you with that answer. Now let's talk about testicular health. Again, it's most common between the men in the ages of 20 and 44, and average age early 30s, right? And not many people talk about the monthly testicular exam. We talk a lot about the breast exams for the women, but not much is talked about when we discuss and when we talk about the testicular exam. It should be done once a month, a self-check in a warm shower. And what they're going to do is gently roll each testicle between the thumb and the fingers and just kind of feel around. And just like I tell my ladies, touch your body, feel your body, get familiar with your body. Because if something is off, something's not right, you're going to know. Versus if you aren't familiar with what it feels like, then you can't really tell when something's abnormal. And so you're really just going to put the testicle in the fingers and just kind of rub around and feel the different parts of like all around it, right? And what you're looking for is any lumps, any bumps, any changes in the size or shape, or if there's any heaviness. Does one look bigger than the other? Does one look a little swollen? Is there any redness or change in color? Those are things that I want you to take a look at. And so I can tell you, as women, you can perform those exams on your significant other. You can help them out with that. You just like I shared with breast cancer. One of my friends, her husband actually found her breast cancer. And that's common in many women that their significant others will find or can find, notice the difference, right? Or feel the difference. And if anything feels off, they should call their provider. No waiting, no embarrassment. Call your provider. Those few minutes, those few days, few seconds that it takes you to call that provider could literally save your life, especially if something is abnormal. And so if the young men in your life are checking the stats on their phone, which we all have our phone, we constantly on those phones like all day long, they can check themselves at least once a month. And I, growing up, well, when my son was younger, I remember having those conversations with him about the different things that he should be checking and looking for. And he kind of looked at me like, "What, mommy? You want me to do what?" And I say, "Yeah, you want me to do it?" And he was like, "Oh, no, 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 I'll do it." Okay, then. It's important that you check these things, especially if they use tobacco, if they smoke, if they vape, if they have certain lifestyles, things of that nature can put them at a high risk, especially we see it mostly in younger white men and those individuals who chewing tobacco and things of that nature. Not saying that it doesn't impact all men, but there are certain groups of men who are at higher rates of developing this type of cancer because of lifestyle things, and modifying those things and getting rid of those things can definitely help. The next thing I want to talk about relates to metabolic health, their blood pressure, their blood sugar, and their weight. All three of these things can be the perfect storm or no storm at all. And so these are the three pillars and stuff that we want to know and we want to take care of, because these things slowly wear our men down: the blood pressure, blood sugar, and weight. And every man should know what his blood pressure is. Again, the normal ranges, and depending on what guidelines you look at, I like to look at the older guidelines, 120/80. Some individuals and some guidelines have moved to 130/90. However, for me, I tend to like to aim for those lower numbers, right? And then the fasting blood sugar and A1C. We know anything above 6.4 and above is a diagnosis of diabetes. 6.5 and above is a diagnosis of diabetes. 6.4 below can be either no diabetes or borderline, right? We don't want anybody borderline. The cholesterol, and then the waist size. Belly fat puts you at risk for developing diabetes and heart disease. So it's important that we monitor that. And just as with women, as we age, our hormones fluctuate, and the same holds true for men. Their testosterone levels begin to decrease, and they begin to notice some weight gain around the midsection, and that's what we call that visceral adiposity. They gain the fat in their waist or their midsection, and that fat can increase cholesterol, blood pressure, and also blood sugar. And so, one, they need to make sure they're getting a yearly checkup, a full physical exam where they're going into their healthcare provider. They are stripping down to their undies, sometimes none, depending on what type of exam they're going to have. And they're getting a full head to toe assessment. That provider is touching, they're listening, they're tapping, they're feeling, they're they're pressing on the belly, they're checking the lymph nodes, they're checking the ears, the eyes, the nose, mouth, all of that, the heart, the lungs, they're checking the kidneys, they're checking, all the things, because we don't want to miss anything. They're looking at the skin. Are there any moles and things like that that may have changed? Is there any skin, things that may be going on that the man may not be able to see? We need to be able to get those full physical exams. And then if these individuals have high blood pressure, one thing I tell all of my patients who have elevated blood pressures is to get a home blood pressure monitor and to monitor their blood pressure at home. And then we follow up every couple of weeks just to kind of see where those labs are. They can text me, they can send it through their patient portal, but I like to know and see what they're trending, because I don't want to wait 3 months down the road when they have to come back to me and their blood pressures have been through the roof and they didn't communicate that. It's important to have that open dialogue with your provider, whether it be through your patient portal or what have you. And not all providers are as reachable as some others, right? Depending on how busy their practice is, they may have other means of you checking in, or they may have you come back in the office. But whatever your provider does, I want you to stick with that and make sure that you're communicating openly about what's going on with you. And then simple blood work. They'll do a standard panel, including the fasting glucose, A1C, probably look at your cholesterol numbers, your chemistries, your electrolytes, all the things. Check your kidneys, get a urine sample. So those are just some standard blood work that should be done. And depending on each person, it's not a cookie cutter set for, list of blood work, depending on your particular health situation. And the other important key is following up after you get the blood work, or going to get it done, not just getting a lap slip and leaving it in the car, not going back and getting the blood work done. Don't have your provider hunting you down for blood work that you haven't gotten and it's been a year. Go get the blood work done. Go get your blood work done. I want to shift into something we don't see on lab work, right? How our men are really doing on the inside. And it's all about things that men struggle with and how they struggle with asking for help. We hear so much in society, or we've heard so much in society in years past. And I'm so grateful that the narrative is changing. The narrative is definitely changing. We used to see, be strong, men don't cry, man up, right? Fear of being seen as, and turning pain into work, and alcohol, anger, and all the withdrawal things that come from all the pressures that have in the past. I say in the past because I'm grateful to see the narrative changing and signs that he's struggling. How do you know when the men in your life, when the man in your life is struggling? Are you having those open conversations and making sure that there's that open dialogue? What does it look like when he's angry or irritable, right? Instead of showing tears, it may show up as anger, right? Pulling away from family and friends and isolating themselves instead of talking about what's really going on because one reason or another. Having trouble sleeping, or sleeping all the time, or not being able to sleep and staying up all night, changing in their appetite or their energy, and talking about being a burden and hopeless and that the world would be better off without me. Those are all signs that they are in trouble. And we need to work before they get to this point. But how do we start this conversation? You don't have to be a doctor to start a conversation and have open dialogue with your partner. I've noticed you seem really tired and quiet lately. I'm not judging you. I'm just checking in on you. Good conversation opener. And you don't have to fix it right now. I just want to know you don't have to carry it. I want you to know you don't have to carry it all alone. These statements can be a matter of life and death for someone, especially if you're struggling with stress, with the weight of the world, with all the things that they have to deal with. I know me, I'm a woman. I deal with a lot, but I also know that my husband also deals with a lot as well. And so we have to make space for them, and we have to make sure, and I keep saying this, be that safe space and provide that safe space for them. Let them enjoy their outlet. My husband loves to fish. I will never tell him, one, I'm not his mother. So I'll never tell him, no, you can't go fishing, because I'm not his mom. He's an adult. He can make a decision on what he wants to do. Yes. Do we talk about it? Do we kind of arrange schedules? Yes, of course. And so if that's his outlet, hey, sometimes I tell him, go fishing. You just need to go fishing. Yeah, go and get on a boat, go fishing. Because I can tell and I can see when things are shifting and when things are changing. And he's not very vocal about what he feels, and he'll talk about it, but he's not one to complain. When do we know when things are urgent? Because it can get to when it's urgent. When someone talks about wanting to die, feeling like they're a burden, or having no reason to live, those are emergent signs and we need to get help. And unfortunately, in certain communities, there's fear of calling the police when we have a mental health crisis. And I've seen some improvements in that, and there's definitely some more improvement that need to be that need to happen, but there's a lot that can be done in that sense, in that place. Get them the help that they need and encourage them to utilize the resources. The 988, you have that, the U.S. crisis and suicide line, going to the emergency room if there's an immediate danger, and then reaching out to a provider or therapist if they need help. And those are the first people that you can get to. I'm here to say at Wells Legacy Health and Wellness, we are open, and I've received the calls, I've received the text messages from individuals needing help, and we've talked with them and gotten them the support that they need and gotten them in contact with the resource. You don't have to be my patient for me to provide you with some resources and help. That's just who I am. That's just who I am. Type he matters. If there's a man whose mental health you're going to check on this week, type he matters, because I know for a fact we need to be checking in on the men in our lives. So when it comes to, we talked about all like the medical stuff, but you guys know I love the wellness twist, the daily habits for our men and for us. What are some of the things that we can do? Screenings that save lives, but daily screenings, again, save lives. But it's those little things, those little small steps and small changes that we make can definitely shape and increase our quality of life. So we're going to talk about that movement together. You guys know that I preach 30 minutes of moderate intensity exercise 5 days a week, where you're going to get, that's cardio, where you're going to get even weight training, where you're going to get your heart rate up, and you're going to do the things, the brisk walking, the biking, the dancing, the things of that nature. And a lot of things that we don't think is exercise is walking the dog, playing basketball, yard work, biking, getting out, doing different things. But the key is you got to get your heart rate up. You have to get the heart rate elevated. So some of the challenges that I want to put out there. Can you and the men in your life log 60 minutes of movement a week? For the 60 men lost to suicide every hour around the world. 60 minutes a week. When we think about 60 minutes a week, that's 10 minutes, 6 days a week. That's 20 minutes, 3 days a week. 12 minutes, 5 days a week. Like we can get there, right? We can definitely get there. My math may be off with that 12 minutes, 5 minutes, I don't know. Y'all get it. What about the foods that can help the heart and the prostate? More, as we talked about it previously, more colorful fruits and veggies, the beans, the whole grains, the fatty fish, the salmon, the tuna, the nuts, the less fast food, less of the fast foods, less of the processed meats, the sugary drinks, and heavy alcohol. And then these are some couples and family ideas. Pick one meal a week and that's heart healthy, and prepare it together, right? I always like to talk about the My Plate planner, where half of the plate is your lean protein, quarter of the plate is your veggies, and then you have your starches and your whole grains. I love that concept. And again, the protein should fit within the palm of your hand. When it comes to stress and sleep, men often undersleep and overstress. And so we want to make sure that they're aiming for 7 to 9 hours nightly. And what are some of the things that we can do? We can create a comfy, cozy environment in the room. We can encourage turning off the phones and screens at least 30 to 60 minutes prior to going to bed. The evening wind down, the stretching, the light reading, prayer, deep breathing, things of that nature that can help. And sometimes it's a team effort. But if it's an individual who lives alone and you know them, maybe suggest some of these things that could help. When it comes to tobacco and alcohol, we want to talk about, have that open conversation about it. Smoking and vaping, offer them support, offer them resources to quit. Then heavy drinking, start talking about cutting back, right? On if they drink 7 days a week, maybe going to 6 days a week, and then slowly decreasing that amount. If there's an alcohol or substance abuse problem, typically they're self-medicating to not deal with a situation or issue that's going on. So, as we recap tonight, we talked about three different pillars. We talked about food, we talked about sleep, and we talked about stress when it comes to the wellness part of it. What pillar do you think men need most right now? Is it moving, food, sleep, or is it stress? Where do they need to focus at right now? For me, I can speak for my husband. I think moving is definitely one. Sleep and stress is are would be second and third. And maybe flip flop stress, sleep, and movement, or movement and then sleep. Whatever you think that man in your life, you know them more than anything. You know what they're dealing with better than anybody. And so, as we close tonight, I just want to say thank you so much for taking time to be with me tonight for Wellness Wednesday. And just remind you, one, to remind the men in your life to know their numbers, their prostate health, check their testicles, do those monthly checks, know their blood pressure, know their baseline blood sugar and cholesterol. And then check the mind, irritability. Are we noticing these things? Withdrawals, hopeless talk. These are red flags that we need to be aware of. And then building those daily habits that can help move more, eating for the heart and brain, protecting the sleep, and cutting back on tobacco and alcohol. Your voice, sis, wife, sister, girlfriend, cousin, friend, your voice at the table with the men matter. And we're not nagging, we're advocating for someone that we love and for their future. And so it's important that we focus on the men. A lot of time we hear about the women and their health, but men's health is just as important. And I have a challenge for you. Here's your challenge. This week, I want you to text or call one man and ask, when was your last checkup? Plan one movement date, a walk, a bike ride, going outside playing basketball, whatever movement looks like to you. And then I want you to share this live or replay with someone and say, you matter. I want you here. I want you healthy and I want you strong. So to my husband, Marcellus Wells, you matter. I want you here. I want you healthy and I want you strong. To my father, I want you here. I want you healthy. I want you strong. You matter. To my brothers, you matter. I want you here. I want you healthy. I want you strong. And to all the men that I know, you matter. I want you here. I want you healthy. And I want you strong. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. And if you're in the Central Florida area and the man in your life needs a primary care provider, Wells Legacy Health and Wellness is accepting new patients. We're here. And even if you have a primary care provider and you can't get in contact with them and there's an urgent need, reach out. We will see what we can do to help and to provide the resources that are so much needed. We offer men's wellness visits, blood pressure, diabetes screening, lab work, and personalized care, as well as hormone health and optimization. Call us, send us a message, or click on the link in our bio for information on scheduling an appointment for your loved one. Thank you for spending Wellness Wednesday with me. And let's make sure the men in our life receive the health care that they need. And as you may see, there are many men who are growing out their mustaches, right? So let's make sure that they're taking care of themselves as well. I'm Dr. Latoya Wells, and together we're creating a legacy of good health. Have a restful night, family. Talk with you soon. Bye.